For patellofemoral pain, so sort of pain around the kneecap, often it's caused by the kneecap not tracking in the right way up the leg. The patella is attached to the quadriceps tendon, and when the quadriceps contracts, it often pulls too far outwards, and it doesn't, because the muscle on the inside is often the one that hasn't got the right amount of tone or strength to it, and what we're looking for is the direction, and what we're trying to do is help that. Often what happens is the muscle on the outside is very dominant and the muscle on the inside is the one that's not working properly. So what we try to do is we tape effectively to try and encourage the tracking of the patella in the right direction. So if we're looking here, say for example, we think that it is tracking too far out like that, what we're going to do is put some tape onto the patella, and so we encourage it to come this way so that when you contract it, it comes up more along the inside, the medial part of the thigh. So what we're going to use some Hyperfix, which is some tape which is just laid onto the skin. It gives it something for the tape to grip to. So that's all we're tending to use. And this is just laid onto the front of the knee, okay, like so. Okay, we get another strip. And lay it onto the knee. That's just for the tape to grip to. So now, as I said before, there's lots of different ways that the kneecap could be moving. It could be tilted that way, so therefore you want to put tape at the bottom to pull it down. It could be tilted that way, so you want to put tape at the top to pull it that way. It could be tilted that way, so therefore you want to put tape on this side of the kneecap. It could be tilted this way down here, so you want to put tape on that side of the kneecap. So the pain, what you've got to do is look at the kneecap itself and decide which way you want to tape it. But I'm going to show you where we're going to bring the kneecap over this way. So over the top of that Hyperfix underneath, I'm going to use some strips of tape. So I'm going to measure them, okay, and then I'm going to place it on the lateral border of the kneecap. Get nice and relaxed, okay, and I'm just going to pull a little bit over here towards the inside, okay. Going to get another strip. And again, I'm going to look at the the outside border of the kneecap. I'm going to push it with my finger across to this side. You can see you did it right because you've got a skin crease on the inside. Now when they contract it, what happens is they feel a pull with the tape, and it encourages them to try and get the kneecap to track in the right way. But as I said, you can do this in all different directions depending on on the way that the patella sits in front of the knee.